Have you ever looked down and noticed that your stomach still bulges outward, no matter how much weight you've lost? Maybe you've blamed aging, stubborn belly fat, or simply getting older. But what if the real reason isn't fat at all? For many adults, especially women after pregnancy, but also men and people who've never had children, that persistent bulge can be caused by something called diastasis recti. Surprisingly, millions of people have it without realizing it. The good news is that understanding what's happening is the first step toward improving it. And in many cases, the right approach to exercise and daily movement may help improve core function over time. Let's start with what diastasis recti actually is. Imagine your abdominal muscles as two long columns running from your ribs down toward your pelvis. These muscles are connected by a band of connective tissue in the center called the linea alba. Under normal conditions, this tissue keeps both sides working together like a strong support system for your core. But when that connective tissue becomes stretched or weakened, the muscles can separate slightly. This creates a gap in the middle of the abdomen. Instead of your core working as one strong unit, it becomes less efficient at supporting your body. This isn't just about appearance. Your abdominal muscles help stabilize your spine, support your posture, assist with breathing, and even help you safely lift everyday objects. When the core loses some of its stability, you may notice lower back discomfort, poor posture, a feeling of weakness when standing up, or a belly that seems to push outward whenever you cough or get out of bed. One of the biggest myths is that diastasis recti only happens after pregnancy. While pregnancy is a common cause because the growing uterus stretches the abdominal wall, it's certainly not the only one. Repeated heavy lifting with poor technique, chronic coughing, obesity, rapid weight changes, or simply age-related changes in connective tissue can also contribute. After the age of 50, our bodies naturally produce collagen more slowly. Collagen is one of the proteins that helps connective tissues stay strong and resilient. Over time, this natural decline may reduce the ability of tissues to recover from stretching or repeated strain. That doesn't mean improvement isn't possible. It simply means recovery often requires patience, consistency, and choosing exercises that encourage proper core engagement instead of placing excessive pressure on the abdominal wall. And this is exactly where many people unknowingly make things worse. They spend weeks doing endless crunches, sit-ups, or aggressive abdominal workouts because they've always been told these exercises flatten the stomach. But if your abdominal wall is already under strain, some traditional core exercises can temporarily increase pressure inside the abdomen. For certain people with diastasis recti, this may cause the midline to bulge even more during the exercise. So if crunches aren't always the answer, what should you do instead? That's where one simple core activation technique comes in, an exercise that physical therapists commonly use to help retrain the deepest abdominal muscles and improve core control. Now let's talk about the exercise that can make the biggest difference, not because it's a miracle, but because it trains the muscles that many people with diastasis recti struggle to activate. The muscle we're targeting is called the transverse abdominis. Think of it as your body's natural support belt. Unlike the visible, six-pack muscles, this deep layer wraps around your abdomen and helps stabilize your spine, pelvis, and abdominal wall. When this muscle contracts properly, it gently supports the connective tissue in the center of your abdomen instead of pushing against it. One of the safest ways to begin activating this muscle is with a movement often called the abdominal drawing maneuver. Here's how to do it. Start by lying on your back with your knees bent and your feet flat on the floor. Relax your shoulders and breathe normally. As you slowly exhale, imagine gently pulling your belly button toward your spine. The movement should feel subtle, not like you're sucking in your stomach as hard as possible, but more like tightening a wide belt around your waist. Keep breathing normally while holding this gentle contraction for about 5 to 10 seconds. Then relax completely. Repeat this several times. If you're doing it correctly, you should feel your lower abdomen becoming firm without your ribs flaring upward or your lower back pressing forcefully into the floor. Once this becomes comfortable, you can practice the same gentle contraction while sitting, standing, walking, or even lifting light objects around the house. That's one reason physical therapists often recommend this exercise. It teaches your core to work during everyday activities instead of only during workouts. At the same time, there are a few habits worth avoiding while you're rebuilding your core. If an exercise causes your abdomen to bulge outward along the midline, that's usually a sign that your core isn't managing the pressure effectively. Rather than pushing through it, modify the movement or speak with a qualified physical therapist for guidance. The goal isn't to avoid exercise altogether. In fact, regular movement is one of the best things you can do for your overall health. Walking, gentle strength training, balance exercises, and core-focused rehabilitation can all be valuable parts of recovery when they're performed with good technique. Nutrition also plays an important role. Your connective tissues rely on adequate protein, vitamin C, copper, zinc, and other nutrients involved in collagen production and tissue repair. Vitamin D is essential for muscle and bone health, but supplementation should be based on your healthcare provider's advice or blood test results rather than guesswork. And remember, healing doesn't happen overnight. Some people notice improvements in a few weeks, while others may need several months of consistent training. The timeline depends on factors such as age, the size of the separation, overall health, previous pregnancies, body weight, and how consistently the exercises are performed. There are also times when exercise alone isn't enough. If the separation is severe, if you have a hernia, persistent pain, or significant functional problems, it's important to be evaluated by a physician or physical therapist. In some cases, surgery may be the most appropriate treatment, and there's no shame in that. The goal is always to choose the safest and most effective option for your individual situation. Here's the most important message I want you to remember. Diastasis recti is not a sign that you've failed. It's a common condition, and with the right guidance, many people can improve their core strength, posture, and daily function without chasing dangerous shortcuts or miracle cures. Take one small step today. Learn the correct technique. Stay consistent. Give your body time to adapt. Your core has supported you for decades. Now it's your turn to support it.